Breaking news out of Highland Park right now. Medical officials giving an update about that shooting that happened at a 4th of July parade in Highland Park. 6 people killed, 24 injured. Let's listen in.
Sure. So for those of you who didn't hear, just a brief rundown of what occurred today here at Highland Park Hospital. Shortly after the events that occurred in downtown Highland Park, our team here at Highland Park Hospital was notified of multiple victims that were involved in a mass shooting or casualty event. Our team very quickly activated one of our internal messaging codes called Code Yellow, which is for mass casualty and trauma response, to mobilize our surgical teams, to bring in other resources, and within a very short amount of time started to receive a number of ambulances from the emergency medical services system. We received in total about 26 total patients, 10 of which were transported by ambulance. During that time, in a very short amount of time, we had nearly 20 additional physicians and more than 20 additional nursing and support staff here in our emergency department, as well as in other areas of the hospital, to help take care of the patients that were brought in. And all of those individuals came as a result of following our protocols. We also put in a extra safety or security protocol where we locked down the hospital, hence why we're meeting out here in the parking lot as we continue to try to maintain a very safe environment in our hospital for our patients and our staff.
Doctor, could you talk about the injuries?
So of the 26 individuals that showed up here at Highland Park Hospital, 25 of those did sustain gunshot wound injuries. Some of them were minor, some of them were much more severe, and some of those patients were in critical condition when they did arrive here to the hospital.
Any commonality between the gunshot injuries? Were they all different parts of the body?
They were all different parts of the body, extremities as well as other more central parts of the body as well.
Do you have any specific number on what conditions those 25 were in?
Yeah, so of the 25 who came in with gunshot wounds, 19 of those individuals were able to be treated and actually discharged home after they had had their full medical evaluation and treatment. Several others did arrive in more serious conditions and did have to be admitted. We had one that had to be transferred over to Evanston Hospital under the care of our great neurosurgical team. We had a couple of other patients that need to be admitted to either our trauma surgical team, which are represented here, as well as to some of our orthopedic trauma surgeons.
Doctor, could you give us an age range of the people you treated?
Absolutely. So the age range ranged from about 8 years old was our youngest patient, up to 85 years old.
How many children?
I can't give you a specific number on the number of children, but it was definitely around 4 or 5.
What happens in an emergency room when you get that many gunshot victims coming in at once?
Well, we immediately have to make space for all these patients to come in, and hence why I commented before how we use some internal processes to mobilize resources. Our wonderful surgical and trauma staff were immediately alerted through emergency messaging that we had a number of patients that were going to need emergency medical services and their evaluation. On top of that, many other emergency physicians, pediatricians, internists, surgeons, trauma surgeons, anesthesiologists, and others were also notified and mobilized to help take care of the number of patients that were coming in.
Your staff looks, of course, shaken up. What is this like? Have to deal with such a massive casualty?
Well, I think, listen, there's been a lot of different events that have happened in the United States, and this obviously now has hit very close to home. It is a little surreal to have to take care of an event such as this, but all of us have gone through extensive training. We go through a number of different programs, training. We practice for these events, even though we hope they never happen. And so I think our team very admirably handled the situation today. Of course, we provide services that include social work, and we have others involved that our team, as well as our patients, will have a chance to talk to therapists and counselors to debrief after something that is so traumatic.
Doctor, anyone has a loved one in the hospital, or anything they need to know, or have families all been notified?
So families have all had the opportunity to actually come into the hospital and wait. We had liaisons working with those family members, and all of those family members have been reunited with the patients that were here and treated at our North Shore hospitals.
Anybody from the nursing staff that perhaps might want to talk?
Does anybody from the nursing staff want to talk? Come on up. So this is Barb Croak. She's one of our emergency medicine nurses. She also does a number of administrative roles here at North Shore and has a wealth of experience.
Good afternoon.
Tell us what it was like for the nurses.
So we have an amazing team of nurses who every day give 1,000% of their time and talent to their profession. They all immediately go into emergency mode, and they are trained in trauma and pediatric care as well. They have extensive training. They're amazing people. They showed their proof in COVID, and now with this absolutely upsetting and tragic.
You are listening to medical officials who are giving an update on a mass shooting at a July 4th parade that happened in the Chicago suburb of Highland Park. That's about an hour south of Milwaukee. 6 people killed, 24 injured, and we've just learned that the age range and the number of people who were hurt here, 8 to 85, 4 or 5 of them were kids. As for those who were killed in this incident, it sounds like all of them except for one were adults, and then there's also one child who was injured. We're going to continue to stay on top of this and bring you the very latest developments on the news at 4:30. Right now, we are going to take a quick break. We'll be back with more on this right after this.